But let's bring it to this now. Gauteng's health department has issued a concerning report indicating a surge in the transmission of sexually transmitted infections and HIV infections, with over 1,000 men testing positive between April and December 2023 in the province. Notably, the data reveals a significant disparity in health-seeking behavior between men and women, potentially jeopardizing men's overall health and their well-being. Now, the urgency to address this issue is evident, requiring immediate interventions to tackle the factors contributing to delayed health-seeking behavior among men with STIs. Now, to delve deeper into this critical matter, we're now joined by Doctor Shandir Ramlagan, Chief Research Manager in the Public Health Societies and Belonging Research Division of the Human Sciences Research Council. Thank you so much, sir, for your time this morning. So, of course, this must be, concerning for you, and particularly where it speaks to, societal factors maybe having, contributing to the men's, hesitancy in terms of seeking, medical help, particularly for STIs. I mean, how concerned are you about these numbers that are increasing?
Yes, good morning, Unati. Thank you for having me on. We are very concerned. If you look at South Africa, overall 12.7% of the population has HIV. That translates to about 7.8 million people. If you look at just Gauteng alone, that's about 15% of the population in Gauteng alone have HIV. Now, what we know traditionally is that men do not go to clinics. They do not go to doctors. If they have some sort of medical ailment, they'll generally take 2 painkillers and try to sleep it off at home, or try to deal with it with some other way, either go to a traditional healer or take over-the-counter medication. So if men or people in general are not seeking medical help, it does basically present a problem, because it means that these STIs are being transmitted. Now, the reason that these things are also being transmitted is because of the different sort of behaviors. What we find is that people are having multiple sexual partners. So having multiple sexual partners is a problem, and it becomes a bigger problem if you're now not taking the precautions. And precautions that I'm talking about is utilizing condoms. So we have quite a few people that are basically having multiple sexual partners, and then of those people, they're also then not utilizing condoms when they're basically having multiple sexual partners. And this then causes more problems for us, and obviously more concern, because as it happens, it is very easy to actually contract an STI, and so therefore this is basically a never-ending problem, because it's continually being transmitted.
Now, of course, this is an issue that requires, as we said in the intro, immediate intervention, to tackle just some of these factors, which pretty much may lead to more increases in HIV infections, as it were. How do we begin to address, the behavioral change, which is so significant here?
Okay, so we need to do things like this. We need to talk about it. The problem with men is that we don't actually talk about it. But not only men, even like when it comes to, say, parents and their kids. Parents think it's somebody else's duty to basically talk about sexual issues. So they don't really address it themselves with their kids. So if we start talking about it, if we have more advocacy, more advertising, have forums where people can openly discuss issues, we can encourage kids to, and when I say kids, I'm talking about those 15 years old and above, because obviously they are having sex, to go out there, find out about their sexual health, go and get tested. Men as well, to basically go and seek health. If they do have multiple sexual partners, go and get tested with your partner, see what the situation is before you engage in sex. And if you do engage in any sexual activity, then at that case, please get condomized in order to actually protect yourself. So these are some of the things that we're actually talking about. Something else is even something as simple as going and getting a circumcision. What we know is that circumcised men are protected against getting STIs. So something like this is important. So condomized, talking about it, getting circumcised, try to obviously limit your sexual partners. That's something obviously that's very vital. And if you can't do that, then of course you are going to basically be limiting your chance of actually getting any sort of sexually transmitted infection.
So, are there any specific demographic or maybe cultural factors, that play a significant role in shaping men's attitudes towards healthcare-seeking behavior for STIs? I know I hear you speaking about various interventions that can be taken, but how then can we address them? Particularly in as far as the diversity factors are impacted.
I think this is it's a very interesting question that you basically answered. It's something I really want to get more into, like in terms of research. What we find is that men all around the world are basically the same. I know I'm going to probably get shot for saying something like that, but men don't generally go out and seek help. So whether you are in the US or in South Africa or in China, you tend to basically have a problem, then kind of sit with your own problem, and then try to see what medication you might have at home, or try to solve other sorts. But only if it becomes really, really bad, then on you go. So whatever the intervention actually is, it needs to be targeted to all men equally. I mean that's the be all and end all of it. Men unfortunately don't seek health. Now, what we do also know is that at clinics, a lot of the clinic staff as well, and some of the interventions that I've worked with and some of the work, is that clinic staff always complain that the clinic setting is basically men generally don't come to the clinic setting. But then again, we have men's clinics as well, where men can actually go. But again, if you look at the numbers there, it's quite low. So I think what we need to do is start changing the attitude of South Africans, of men all around, to say that any clinic is both for males and for females. It's not only for women. Even if you do not want to go to the clinic, you can basically seek private healthcare, go to a hospital, or go to a men's-specific clinic, if you can find one, and therefore seek help at that place. I mean, and in some of these instances, you can even go off to specific pharmacies, because I do know that pharmacies also sometimes, in a lot of the cases, should I say the ones that I sometimes visit, would have a little clinic or a nurse there that will basically also see to patients. So that is also an option for people to go to. But we just have to do a bit more research to try to find out how is it that we can get men into these facilities to seek this help. But it's not only men that we're going to look at, it's also women. And I just need to basically say that if you look at, say, those women, I got the stats over here, those women that basically have multiple sexual partners, in the age group of 15 to 24, it's actually less women that utilize condoms than men, oddly enough. So this affects basically both, because the men are having sex with somebody, and I mean so it's both men and women that need to basically protect themselves. And if a woman becomes infected and say she becomes pregnant, we then lead to other complications, because then it negatively impacts the baby. The baby could pass away. The baby could basically be born with an STI. It could lead to neurological conditions in the baby. So we need to basically protect both men and women when it comes to STIs.
Now, of course, the Gauteng's Health Department report indicates that over 1,000, women and men tested positive for these sexually transmitted infections and HIV infections in a very short space of time in 2023. These are the numbers that we know of. How concerned are you that there are actually numbers that could possibly be much higher that we don't know of?
Okay, no, this is of concern to us, because for those that basically got tested, there's a whole range of other people that, of course, did not get tested. And this happens because those that are seeking help or assistance go out and basically get tested. But what about all of those people that basically do not seek help, that basically try to hide this, or basically try to get other sorts of assistance to treat this STI? I've heard of, and of course I'm just basically talking of what I've heard of, is that there are people out there that like it may not finish their course of antibiotic medication, and because of that they obviously have some spare medication left at home. So people then end up sharing medication. So we know about sharing medication from other studies and things like that. So if people are sharing medication and then don't get tested, this stat is basically not being recorded down. So it is of great concern that if the figure that is released by the Department of Health shows that it's 1,000, that figure could potentially be a bit higher than that.
And of course, there is, what is known as medication fatigue that possibly also plays a role.
Yes, so medication fatigue is not a big concern. Okay, it's a big concern when it comes to HIV. And what we find is that after about a year of taking the antiretroviral medication, then people kind of feel that they're healthy and that they're strong and that they no longer need the antiretroviral medication. And that's where medication fatigue comes in. What happens is that people, when they're taking the antiretrovirals, after a year or so, will stop taking the antiretroviral medication and then move on from HIV positive to becoming AIDS, having AIDS. Now, this is a problem because if you stop taking the antiretrovirals, you basically make the virus stronger, and then the next time round, you might need a second line of antiretroviral medication. But when it comes to other STIs, the good thing is that you might just need a much shorter course of antibiotics, and that could actually help you. So it depends on what STI you have. So in antiretrovirals, when it comes to HIV, that you need to take lifelong, and you can live a good, healthy, happy life for the rest of your life, your natural life. But when it comes to other STIs like gonorrhea, syphilis, and stuff like that, it could depends on what you have. It could require a much shorter course of antibiotics. But in order to actually find out what you need is that you need to go and get tested. I think that's what's the most important thing, is that once you find out that things are actually not right, you need to actually go out, seek medical attention, get a test, and then get put on the right medication to actually help you.
Very quickly, Doctor, as we wrap up, I mean, of course, there are those STIs that are more concerning than others. Just talk to us briefly about those, particularly the MUS.
Okay, so I really do not want to basically say that much about it. I would rather say that all STIs are concerning, because if you get in one, the chances of you getting others is high. Okay, syphilis, I think that what we basically talked about is quite quite dangerous to basically women, and as I said, basically babies. So that's something that's of great concern, and I think that's the one I want to highlight. But the chances is that if you are prone to getting an STI, then you are not taking care of your sexual health. And if you're not taking care of your sexual health, the chances of you getting another STI is also higher. And so therefore, I would encourage all people to basically treat all STIs as basically dangerous, and all STIs as something that obviously you definitely do not want, and that should be treated immediately.
Thank you so much for your time. I really do appreciate it. Dr. Shandir Ramlagan there is the Chief Research Manager in the Public Health Societies and Belonging Research Division of the Human Sciences Research Council.